Okay, today we're going to talk about doing a blood glucometer test or blood glucose test, or some people may call it or refer it to as checking your blood sugar. Okay. Um, Items that you're going to need is you're going to need gloves if you're checking someone else's. If you're checking your own, most people don't use gloves. You're going to need the little lancets. Okay, this little lancet pen. And you're going to need your little lancet needle that goes in the pen. I'll show you how that works in a little bit. You have your glucometer, okay? And you have your test strips. Test strips are in here. Usually you'll find all this in nicely compacted into a little case that people will carry, and all this fits in nicely, okay? You're going to need some alcohol wipe and probably some gauze, okay? So first I'm going to kind of tell you a little bit about the machine here. So every machine is completely different. The one that I have is called a Care Touch. The concept is the same. The operation may be slightly different, but you're going to get a reading of the amount of glucose or sugar that's in the blood, and that's how they can tell you if you're high or low. The normal glucose reading is usually between 70 to 120. For a diabetic, they may be at 150. A doctor may be okay with that. And everybody is different. When they get to low levels, such as less than 70, you know, you may start feeling weird, shaky. You may start feeling clammy, so cold, having those feelings. And some people know when their blood sugar's low and they're like, I gotta check it. When that happens, then they take some type of sugar, such as candy. And they'll usually have pieces of candy with them, or drink some soda to kind of help bring that blood sugar up. Now, on the opposite end, you may have somebody that will have a glucose 2, 3, 4, 500s. I've seen it greater than 500s. This meter here will only show you up to 500, and if it's greater than 500, it may read HI, meaning high. If it's lower than 40, it will read LO, meaning low. Okay. So in the ones like in the hospital, you know, you get a blood test and it tells you exactly what the number is. Okay. So hopefully we don't have numbers like that, but it's very important to know how this works. Okay. So I'm going to show you. I washed my hands prior to. We will have hand sanitizer to do this, and there's also gloves and things in the kit. Now, I actually have this container which all these items will go into, but just so you know, okay? So I'm going to have everything prepared. I'm going to take my lancet, the cap comes off, the pin sets down inside here, okay? And this little cap twists off, and now it's on the floor. And then the cap goes back on, okay? If you notice, there's numbers on this pin. It may be difficult to see. There's numbers on this pin. And this is actually the depth of where, how deep you want it. It goes all the way from 1 to 10. 10 meaning it's going to go really deep. We're going to put it midway at 5. If I don't poke myself. Midway at 5, okay? So I've got it sitting at 5 here, okay? Another thing is that when you do that, you have to pull this plunger because it kind of preps it so it's ready to poke you. And then you have your test strips. You want to make sure that you keep this vial closed, so when you get your test strip, open it up, take one strip out, close it right away, okay? Because you don't want air to affect it. And these little strips, they have like, looks like a computer chip on one side, and then it looks like it has a little small opening near Care Touch. There's a white side and then there's a dark side, okay? So the computer chip And this one actually has an arrow that kind of tells you. It's kind of hard to see. Has an arrow right at the tip there that will tell you it needs to go into this machine, okay? There's a slot here. So if you put that in the machine here, it will turn your machine on. And currently right now, it's telling us it was quick. It's telling us it's operating. So you see that looks like a teardrop? It actually represents a drop of blood. That means this machine is ready for you to put a drop of blood on it, okay? I may end up restarting this because after a certain amount of time, this machine will shut off. And I want to actually walk you through of what you need to do, okay? So I'm actually going to pull the strip out and we'll redo it again. And lay it here and we'll start again and I'll show you again. You make sure you have your gauze and alcohol wipes, okay? I have some of these available, okay? So, and have that ready. So I've washed my hands. Anybody else, I would wear gloves, but since it's my blood, I'm not gonna do that because I'm poking myself just so I can show you how that works, okay? So now I'm gonna put my test strip back in there so we can get it started, okay? Remember my test strip goes in here like this, and then it shows number, and then it tells me my drop of blood, okay? So I'm gonna lay this here. I'm gonna take my alcohol wipe, open it up, and you can just open it down the middle, and then I'm gonna clean my finger, okay? One of the things that I tell people to do is you wanna milk the finger. You wanna get that blood down at the end, okay? And you can do that before you even wipe it off. But get that blood down to the tip of the finger. And then I kind of hold it there, and you'll see a difference. I'm gonna wipe this off again. And I prep this. Poke on the side of the finger. It has less blood, so it's less vascular. So it won't be as painful, okay? So pick on the side of the finger, okay? And then there's a button you have to press. So you put it firmly, press it, okay? So you see I've got my blood. I'm squeezing, got a nice little drop of blood, okay? I'm gonna put it here. It's going to soak it up. And it's soaking it up. It starts doing a countdown at 5, 3, 2, 1. So right now, my blood sugar is 96. That is a very, very good number. It's between the 70 and 120. However, I am not a diabetic. I wish my sister was here because I would be checking her blood sugar and you would probably, most likely, see something abnormal because she drinks everything, regular sodas. But this is a good number. So you want to definitely see this. Now, I had soda. So if I didn't have soda, my blood sugar probably would have been even lower. But I don't have the effects and things like that. Okay? So I'm taking my my cotton swab or gauze, and I'm just applying pressure on my finger. You want to make sure if someone's on a blood thinner that their bleeding has stopped, okay? And then you just kind of take the thing out. This machine will shut off by itself. With this machine, there's also, so if you haven't noticed, there's also a memory mode, so you can go back in and see what the blood sugar is. So M means memory, so if I press this, it's going to show me that, it was just on there, that my blood sugar was 98. That's exactly what I just did, okay? It comes with a little case. It comes with a instructional book. Kind of tells you about different things. Now, it'll show the date and the time that this is done because I've had it set up. But we definitely want to make sure that people with diabetes, type 1, type 2, and there's different symptoms and different people that are getting those types. I'm going to do an educational class on those, and we'll talk about diabetes, the different types of diabetes, what you need to watch out for, the foods that you need to eat with diabetics. But just, make sure it's important that they're checking their blood sugars as ordered by the doctor. They may have to take them just before their meals, which most often, usually people take their blood sugars 4 times a day before their meals, 3 times before their meals, and then before they go to bed. And they may have to give insulin, or maybe they take an oral insulin pill. So those things that we need to be aware of. There are certain foods that they can eat. They have to avoid regular sodas because those can bring those levels up. But I will have a educational talk about that, and I look forward to seeing you guys at the class. Bring a friend.